星期五早上的时段在开怀值班，看到他从疗程结束羞涩的来开怀当志工，到现在愿意发挥他的所长，为开怀、为乳癌姐妹们服务，真的很感念这份心。那就让我们欢迎漂亮的洋娃娃林秀，请掌声欢迎。
接下来邀请到来自新加坡的 Dr.Yong 杨医师。Dr.Yong 目前任职于新加坡中央医院外科部门以及新加坡癌症中心癌症部门专科乳房外科肿瘤学。他在2000年开始医治乳癌患者。对 Dr.Yong 来说，治疗每一位乳癌患者都是独特而且难忘的经验。Dr.Yong 也鼓励他的病患，罹患乳癌并不是世界末日，希望能够帮助乳癌病患克服他们的心理障碍，继续过着美好的生活。在此次的演讲会讨论到乳癌在新加坡的发生趋势，以及乳癌防治日在新加坡是一个重要的节日，来增加民众对乳癌的了解。现在，让我们以热烈的掌声欢迎来自新加坡的 Dr.Yong 上台，为大家以英文介绍新加坡病友乳癌病友团体现况。谢谢。
大家好，我讲英文，对不起。I will be speaking in English. I'd like to thank the organizing committee for inviting me here to give a short talk and to share with you all our experience in Singapore about breast cancer and how we have been treating breast cancer and what our support groups and our breast cancer survivors are doing in Singapore. I would like to cover with you this afternoon what are the incidents of breast cancer in Singapore, what the government has done in order to detect breast cancer at a very early stage, and I would like to share a little bit about what we do during our Breast Cancer Awareness Month in the month of October, and also something about our breast cancer survivor support groups. Next, please. Breast cancer is the most common cancer among women in Singapore. It affects approximately 54 out of every 100,000 women per year in Singapore, and about 200 to 300 women die from breast cancer every year. In fact, every year we see about more than 1,000 new patients with breast cancer in Singapore. Next, please. This is a graph from the Singapore Cancer Registry, where we keep a record of all the cancer cases diagnosed in the country. As you can see, breast cancer is the highest and the most common cancer among all our women in Singapore. Very high compared to the rest of the other cancers such as colon, lung, and cervix. Next, please. Also, the incidence of breast cancer in Singapore has been on the rise. You can see from the highest chart or the line that the incidence of breast cancer is on the ever increasing, or what we call an exponential rise compared to the other cancers since 1968 until now. The number of breast cancers is ever increasing. When do our patients or when do our ladies in Singapore get breast cancer? Unfortunately, breast cancer is diagnosed in our patients among a when they are in the most productive age group, in the late 40s to early 50s. This is when it is most common for our patients or our women in Singapore to get breast cancer. Singapore likes to be #1 in many things in the world. We are very famous for our airport, Singapore Airlines, but unfortunately in Asia, Singapore is also the country with the most common breast cancer, the highest incidence of breast cancer. These are some of the numbers from the United States and Europe. Unfortunately, Singapore is higher than many other countries in Asia. In fact, every 1 in 16 to 18 women in Singapore in their lifetime will develop breast cancer. Previously, many of our patients with breast cancer come with very advanced cancers, and this is due to awareness, and our people and our population not knowing about breast cancer. Next, please. Welcome to the pictures. Okay. Also, but now with more of our patients being more aware about breast cancer, they are coming forward earlier and earlier, and we are being able to detect breast cancer when the cancers are very small. Sometimes when we can not even feel them. Next, please. Okay, so because the government of Singapore has recognized that there is a problem with a rising incidence of breast cancer, since 2002, the government has started a nationwide population-based mammographic screening in the whole country in order to detect breast cancer at a very early stage. This program is run by the Ministry of Health, Singapore government, through the Health Promotion Board. Next, please. And it is called Breast Screen Singapore, or in short, we call it BSS. And this is a program for the whole island of Singapore in order to get our women to go for regular breast screening. Those aged 50 to 69, every 2 years they're invited for breast cancer screening by mammograms. And those from 40 to 49 come for screening every year. Next. All our women are eligible, both Singaporeans and permanent residents, and especially those who are asymptomatic with no breast problems and 40 and above are all invited to attend this subsidized mammographic program organized by the government. Next. There are many screening centers throughout the island. Next, please. And we have shown that those patients who are detected early have a much better survival compared to patients detected with advanced breast cancers. Next, please. And by doing mammographic screening, we are detecting more and more of what we call ductal carcinoma in situ, what we call very early pre-cancer. And if we treat these patients, they may not even develop breast cancer. Next, please. And based on the results of our breast screen, we have screened more than 200,000 women in Singapore, and we are detecting a very high rate of early breast cancer, such as 30%